For the fourth year in a row, Baylor Scott and White Health is teaming up with Dallas Cowboys Dak Prescott to spotlight the importance of cancer screenings. And this year, they've created some of the world's most smallest football cleats to help spread that message. And here to tell us so much more about the My Cause, My Cleats initiative is Baylor Scott and White Health colorectal surgeon, Dr. Katerina Wells. Good morning to you.
Good morning, Erin. Thanks for having me.
So glad to have you here. So before we dive into the cleats, which we love the cleats, we want to get to Dak Prescott, of course. Let's talk about early screenings. Why is it so vital for Texans right now?
Early screening is so vital for Texans now because, well, even across the whole country, 70% of Americans are probably behind, are definitely behind in at least one of their screening procedures.
Wow.
Yes, and we know that early screening saves lives.
It does indeed, it does indeed. So Dak Prescott, he has supported colon cancer awareness for years in honor of his mother. And so how does this partnership with Baylor Scott and White Health help amplify that message? And does it need to be? Is there a need for that message to be amplified?
Absolutely, there's a need. For the same reason, we want to get the message out to every American, every Texan, that they can really take a closer look at their health and engage in with their healthcare providers to get set up for early screening.
Yes, indeed. Well, you just talked about taking a closer look, and I think that's the whole message of this year. You guys, okay, because you see the cleats right here. Yeah, normal size, probably even Dak's exact size. But these ones right here, which I'm going to pick them up so I can see if I can get them. You guys, look how tiny these little cleats are. We literally have to like refocus the camera, my goodness. Tell me, what's the idea behind going small this year?
The idea behind going small is, again, taking a closer look, looking at the small things. And if you think about the connection between these teeny tiny cleats and preventing cancer, especially colon cancer, colonoscopy in a very direct way lets the doctor take a look at the lining of the colon to find teeny tiny growths that we think if we leave them in there to turn into cancer. Of course, that's not good. So during a colonoscopy, we can find those teeny tiny growths pre-cancer, remove them, and prevent cancer from even happening.
It's weird because this year's concept of see the unseen, it almost sounds like it's connected to that in a way. Tell me, expand upon it during routine screenings. Is it kind of that, seeing the unseen?
Exactly. So a lot of cancers, Erin, don't have any symptoms. And so we need to focus on screenings for people before they get symptomatic, before they have that belly pain or they're changing before it's too late. So that's what really screening is all about, finding what people can't see, can't feel before it becomes a problem.
Very good, and you want to do it ahead of time, I'm assuming. Tell me, what is the right area of time to really start thinking about this? When do you know you're in that space of life?
Well, Baylor Scott and White has a great interactive tool to help you figure that out. You can go through your family history and other risk factors to create a customized screening plan. But in broad strokes, every American, at least with average risk, needs to do a colonoscopy at the age of 45.
Okay, very good. Okay, so 45, you guys, that's the number. If you're close to it, maybe even around it, maybe this is the time that we start thinking about it. But I think a lot of the times we start thinking about it and then we think ourselves a little too much and then we decide we don't want to do it. We're too scared. And so tell me, if someone's nervous or thinking, I don't know if I want to know the truth, tell them why it's important to make sure that we go anyway.
Well, we've got to go anyway because even though it sounds scary, it's actually not a bad experience for people at all. A lot of my patients tell me, gosh, I wish I would have done that years ago because it's the best sleep of my life, and now I have the peace of mind to know that I'm cancer-free.
And that's better than anything you could get, right, is the peace of mind. Thank you so
Absolutely.
much, Dr. Wells, for being here this morning, for
Thank you
bringing
for
us
having me.
some tiny cleats in addition to Dak's fabulous cleats as well. We appreciate you and
Thank
your
you.
connection.
Thank you.